My name is Nan Hayworth, and I was privileged to be a member of Congress in the 112th Congress when the great Republican wave came in. And one of my mentors, and a mentor to all of us, a policy genius, Dr. John Goodman, has invited me to moderate this discussion as a member of the Goodman Institute for Public Policy Research Board. And John, as we wait for Newt Gingrich, would you like to tell us just a little bit about your collaboration with the speaker over the years?
Oh, sure. Newt Gingrich and I have known each other for many, many years, and we knew each other when he first became Speaker of the House. Pete DuPont was chairman of my organization at that time, and we had a lot of input into the contract with America. In fact, all the tax provisions of the contract with America came from our organization and were put together by economists that I work with, including the Roth IRA and including the ability of seniors to reach the retirement age and keep on working without losing their Social Security benefits. So Newt and I started then, and then when he ran for president, I was his advisor on health issues, and we've continued to maintain contact. We email each other from time to time, and he's always a source of great ideas, and I love to bounce things off of him.
Sure. Now, didn't you and he not long ago had an editorial piece in the Wall Street Journal?
We did, and we collaborated on that. We collaborated on his health platform when he ran for president, which is pretty much the same thing. And he's been an outlier among Republican politicians. I probably don't need to tell you this, but most Republican politicians don't like to talk about health care. If you raise a topic with them, they quickly change to something else, even though all the polls tell us again and again that health care is the most important issue for voters. That hasn't varied in this whole election season. But Newt's happy to talk about health care, even though many of his colleagues are not.
I'd love to get right to your thoughts on the role of health care policy in this election and why perhaps it isn't being discussed nearly enough by both sides. Please, sir, let us know your thoughts.
First of all, I want to pick up on what John Goodman was saying when I first came on, and that is he and I have a relationship, a mutual admiration society that goes back many, many years. I don't know of any single person spent more time trying to find a way to develop a decentralized, patient-oriented, market-oriented system than John. And his work and the work of the Goodman Institute is just remarkably important. I think that healthcare is probably the greatest area of Republican vulnerability, partially because historically we've had leaders who refuse to think about it. And they do that in part because it's very hard. I mean, this is why John is so important. There's no single part of our system that is more complex than health. It is about 17 or 18% of the economy. That makes it about every $6. It is everything from nursing homes to cancer research to artificial intelligence to epidemiology. It is usually dealt with politically as though finances were everything, when in fact finances are the consequence of your health system. They're not the cause of your health system. And it is filled with interest groups who are tenaciously protecting their particular advantage in their particular piece of turf. I once wrote a book whose subtitle was Pioneers of the Future and Prison Guards of the Past. And there are tons of prison guards in healthcare. And you see this in terms of one of the most popular ideas which John has helped develop, which is transparency. You ought to have the right to know the price of what you are buying and the quality of it. If you went to Walmart or to Costco or to Target, nobody would suggest you ought to go through and fill up your basket without any idea what the cost is and they tell you at the checkout line what you owe, people think that was crazy. What John has done, I think, has begun to lay out the framework for a patient-centered model that uses modern technology. He's certainly been one of the leaders in helping us all understand about telemedicine, about the potential for truly personal information. We're very close to breakthroughs, for example, in cancer, where we're going to be able to treat you for your unique situation and not just have a blanket therapy that goes out to 30 million people or 5 million people. I think similarly, we have a potential to develop a personal, portable insurance system which liberates you, puts you in charge, and which I'm convinced will ultimately save money. I think if we can get the individual back into the system with the right information, we will probably reduce the cost of healthcare by about 40%, which would be an enormous shift in our economy and a great potential for us to be even more competitive in the world. Lastly, I think the challenge is to get Republican leaders to understand that Americans really care about this. They care even more now because of the epidemic or the pandemic. And I think Republicans have to be willing to work with people like John Goodman to develop specific answers, starting with taking care of preconditions and ensuring that people will get the health treatment they need when they need it. Because health is very personal. Health is not like a lot of other issues. It's not abstract. It's about me or my daughter or my mother or my family. But John has contributed enormously. He will continue to contribute enormously. And I think that maybe as early as next week, President Trump will be outlining additional proposals in healthcare that move us towards a more market-oriented, more citizen, consumer, and patient-oriented system, as a contrast to where Biden and Sanders and the big government Democrats would go.
Mr. Speaker, how do you see that's a wonderful piece of news for us to have. How do you see this election playing out at this point, given all the current trends? Give us your prediction for, and I know you're coming out with another very exciting book about solving the great problems of our time. How do you think this election is going to play out for the president, for Republicans, for the conservative cause?
I spent all of 2016 telling people that Trump was probably going to win. So I have I'm like a broken record. I am pretty confident Trump is going to win. I suspect he's going to win by a surprising margin. Mm-hmm. I suspect the Republicans will be +2 in the Senate. We're certainly going to pick up Alabama, and I think we'll probably pick up a couple more seats. We may lose 1 or 2 seats and pick up 1 or 2 to be a wash, but I think on balance, we're going to keep the Senate. I think the odds are 50-50 that Kevin McCarthy will be the next speaker. And I say that because I think you're very likely to see the Democrats disintegrate. Their issue positions are hopeless. Nancy Pelosi got 207 Democratic members of the House vote for H.R. 6800, which is a bill which includes a $1,200 bonus for every illegal immigrant for having gotten into the U.S. illegally. Now, there are almost no districts where you're going to get a majority that favors taking $1,200 from the taxpayer to give to every illegal immigrant, and the incentive that would be for more people to come and immigrate to the U.S. So you go down a series of issues, and on almost every issue, they've now drifted so far to the left that once people understand them, they become unacceptable. There was a report yesterday, I think, from the Wharton Business School, that Trump's budget proposal, not Trump, but Biden's budget proposals are the largest increase in government since George McGovern. And I think that's probably the right parallel. I think Biden will end up becoming the George McGovern of this campaign. And I think that Kamala Harris will turn out to be the worst vice presidential nominee since Tom Eagleton, who had to step down from the McGovern ticket when it turned out that he had electric shock therapy for his depressions. So I'm fairly optimistic that Trump's going to win.
I share your optimism, sir. And do you have another moment to just speak directly with John Goodman about, I think John wanted to just connect with you for a moment. So John Goodman, I'm going to ask you to join in.
Yeah, sure. Newt, thanks so much for joining us. Here's a question that has troubled me for quite some time. Obamacare was passed 10 years ago. And in all that time, there have been many things that have gone wrong. There have been many victims. Some of them have been tragic. But I can't think of a single hearing on either in the House or the Senate held by Republicans where we bring the victims in, we talk about the problems, and talk about a Republican answer. Why not?
Because you have a relatively passive party that doesn't understand very well how to create issues and how to compete. And remember, Trump is unique. He's not a normal Republican. If you're a normal Republican, you get crushed this year. The Republican Party does not have a doctrine and a culture of being on offense. And it's part of what Reagan brought to the party. It's part of what I brought to the party. Mm-hmm. And believe me, to whatever degree it frustrates you, it drives me crazy. Right. And not just on this topic, but there are dozens of topics where you could highlight the destructiveness of the left in ways that would be totally sympathetic and would be very, very hard for the news media not to cover because they have such human interest to them. And it's just very hard to get Republicans to hire the kind of staff that think like that.
That's a remarkable observation. John Goodman?
Yes, they ought to, Newt, they ought to listen to us more. Well, Newt, thank you for joining us. We really appreciate it, and we admire everything that you do. And we're going to send your book to the first 100 people who have joined us today.
That's great. Thank you, John, very, very much.
Sure.
Talk soon.
Thank you, Mr. Speaker.
Thank you.
And Dr. John Goodman, we have the delight of being able to pick your brains for the next 45 minutes or so. So I'm intensely interested, John, in your work with this White House on key policy areas, healthcare, obviously among them, but not limited to that. Tell us what you've been doing.
Well, we've been doing a lot, and the Trump administration has been doing a lot in healthcare, but unfortunately, most people don't know about it because the mainstream media has not covered it, and even the healthcare media has not covered it. But what's happening right now in America is we're going through a radical transformation of American medicine, and it truly is radical. You just think about the ability to talk to your doctor on an iPhone. When we entered this year, as of January 1st, it was illegal for a Medicare doctor to communicate by iPhone, by Skype, by Zoom, the way we're communicating right now, with a patient, except under very rare circumstances. So it almost never happened. And it was illegal by act of Congress. Well, the Trump administration had been working for quite some time to around the edges change this, making what I told Seema Verma were baby steps in the right direction, but they laid the groundwork. And when the virus hit, we had two things going for us. One, the virus created panic in Congress, and the Trump administration had been laying the groundwork for fundamental change. And so Congress reversed itself and allowed Medicare to use iPhones, Skype, Zoom, so forth, to communicate with patients. And I mentioned Medicare, but those of us who weren't on Medicare were also affected because it turns out that Facebook and Skype and Zoom and so forth probably violate the federal government's privacy policies. And so none of us were talking to doctors the way we talk to our lawyers and accountants and other professionals. So in a very short period of time, we had a radical change. As of April, according to Health and Human Services, In the rural areas, 1 in every 5 seniors had had at least one telehealth visit. At least one time they had communicated with the doctor the way we are communicating right now. In the cities, it's almost 1 in 3. And what makes that so remarkable is we're talking about the least computer literate segment of our society. In fact, I know a great many people who told me there's no way that my parents will ever be able to do this. Well, the parents are doing it. And folks, we're just at the cusp of even more radical change, because what's happening now is the typical patient has learned how to dial up the doctor and do a face-to-face virtual consultation, but the typical patient doesn't have any tools in his home to allow the doctor to monitor other than just visual inspection. Well, if you go online, you'll find at Best Buy you can buy a whole set of tools that monitor your vital signs. An oximeter, for example, is a little thing you put your finger into. It's not invasive, and it tells you what your blood oxygen level is. Now, here's why that's important. The COVID-19 virus attacks the lungs, so you might not be feeling any symptoms at all. But if your oxygen level is way below where it should be, then you're in trouble and you need to get help quickly. So that's just one test, but they have devices so that they can look in your ear, they can look in your throat, they can monitor all kinds of things in your home. And I believe we're on the cusp of an even more radical revolution as more patients get more of these devices. I mean, the estimate is that 1 in 3 doctor visits do not need to be in the doctor's office. They could easily be from your home. Physicians have said forever that half the people in the emergency room at the hospital don't really need to be there. A lot of that could be done from the home. And so I think we're on the verge of a real change. One thing you need to know, and this is important, is that every executive order that Trump has signed, and there have been quite a few that I'm going to talk about in just a minute, every one of them can be reversed by the next president. And when Congress has made the administration's job easier, those changes in the law are temporary. They're all tied to the virus. When COVID goes away, your ability to talk to your doctor by phone or email goes away as well. So virtual visits are gone unless we have some permanent change in the law, which right now we don't have. So when I said there's a restriction under Medicare that you can't talk to the doctor by phone, it's still there. It's just temporarily been put aside because of COVID-19. Now, a couple more things that the administration has done. The ability to have a doctor that you can talk to at nights and on weekends. We used to call that concierge care. And when I first learned about it, it was really expensive. I mean, I knew people who were paying thousands of dollars for this kind of service. But there's a new model, basically out of Wichita, that has brought the cost way down. So now, across the country, a mother with a child can have that kind of relationship with a doctor. It costs her $50 a month. It costs the child $10 a month. And they can have access. They have the doctor's cell phone number, and they can talk to their doctor at nights and on weekends. They don't have to go to the emergency room, where they would spend many, many times what the cost of a phone call is going to cost them. And so that is a real change. Then the ability to do this, until recently, employers could not put money into an account for their employee and then let the employee choose a doctor of their choice for this kind of 24/7 service. This is called, we don't call it concierge care anymore, we call it direct primary care, but it's the same thing. And employers got really interested in doing this, and at this time, you go to the emergency room on the weekends, you're going to be sitting around sick people. And so traffic to emergency rooms is way, way down. And it's way, way down, not because people are healthier, it's because they're scared. And what I'm talking about is a way to communicate with doctors so you only go to the emergency room when you really, really need to be there. And if it's something that can be done visually by the doctor, by phone, by Skype, by email, we do it that way. The ability of chronic patients to manage their own care. I'm sometimes called the father of health savings accounts. And I really like health savings accounts, but I have to admit they were mainly designed for healthy people. You know, if you're healthy, you put money into an account and it grows tax-free. And it turns out that this is the best way to save there is. It beats IRAs, it beats 401ks, it beats every other savings vehicle in the tax law if you're healthy and the money grows. But if you're a chronic patient and you have a problem and you need to manage that problem, these accounts are not very friendly, because let's say you're a diabetic and your employer wants you to take insulin or wants you to take some pills. And so he doesn't want a big deductible there. He wants a zero deductible, maybe even pay you to take the medicine. Well, we can't do that under the health savings account law. So what the Trump administration has done is it's taken one of these accounts called a health reimbursement arrangement. And now this year, by executive order, patients are going to be able to have flexibility in their accounts. And this is a huge, huge change in the care for chronic patients. Another focus of the administration has been what I call centers of excellence. Dr. Regina Hertzlinger at Harvard Business School calls them focus factories. Newt Gingrich has written about this. You know, if we want medicine to develop the way other industries develop, people need to specialize and get really good at something. And what we're doing is we're forcing the health insurers to be good at everything. So if you're a health insurer and you go into the Obama exchange, you have to be all things to all patients. You cannot do what Cancer Treatment Centers of America does. Many of you have seen their advertisements on TV. They specialize in cancer treatment. But they could not go into the Obamacare exchange and say, we only want patients who have cancer. And we want to look at your medical records. And if you don't have cancer, we're not the right plan for you. Well, they're not allowed to do that. And we are able to do that in the Medicare Advantage program, and the Trump administration has really pushed to allow even more specialization, even more freedom for those kinds of plans. All this was laid out, by the way, in a document that the Trump administration prepared and published about 2 years ago. It's a 124-page document, and it went through the whole healthcare system and talked about what's wrong with it. And the bottom line was that what's wrong with our healthcare system is not the private sector. In other words, we don't have private market failure in healthcare. That's not why we have so many problems. We have government failure. And the focus of the people who work for Donald Trump has been, how do we change laws, which means most of the time deregulation, in order to allow the private sector to work. This is a message that isn't getting communicated very well during this campaign, not getting communicated very well, in my opinion, by Republican candidates for office. And it's certainly not appearing in the mainstream media or even in the healthcare media. One of the things that Newt mentioned that I want to draw your attention to, and that's the idea of personal and portable health insurance. This is something that my organization has been promoting for a long, long time, probably 20 years, maybe longer. But the way our healthcare system subsidizes health insurance is through employers. And when you leave your employer, you lose your health insurance. But I once asked the head of Blue Cross, why, when it comes time to renew insurance, do I have to buy group insurance for my employees? And he looked shocked. And I said, well, you have great individual policies. Why can't I buy those individual policies for my employees? You know, he'd never thought of that. And we got into a long conversation about it. Eventually, however, the Trump administration came around. Now, what happened during the Obama years is they really didn't like this idea. Before Obama became president, some employers actually did give their employees money, pre-tax money, to buy their own health insurance. And no one was certain about whether this was legal or illegal, however. And most insurance commissioners at the state level had a policy of don't ask, don't tell. And what that meant is if you're an insurance agent and you're selling an individual policy to a buyer, don't ask where the money is coming from. If you know it's coming from an employer, it might be illegal. So it's better if you don't know. That was the rule prior to the Obama presidency. Well, once the Obama administration took over, they decided they were going to put an end to this, and they did. And they put out a ruling, not an act of Congress. This was an administrative executive order that said that if an employer is caught doing this, we're going to fine you $100 per employee per day, or $365,000 per year per employee for doing the horrendous thing of letting your employee have insurance, which they can take with them from job to job and in and out of the labor market. Well, the Trump administration, again, by executive order, no act of Congress, reversed all that. And the Trump administration has encouraged employers to put money into an account so the employee can have insurance they can take with them to the next job. And of course, once we're in an economy like we're in now, with a lot of people losing their jobs, the idea of portable insurance would be perfect. So when people say that Donald Trump wasn't ready for the coronavirus and didn't make the right decisions, his administration made all kinds of decisions that made it easier for us to deal with this virus. You know, if you just think about what I talked about earlier, the ability to talk to your doctor by phone, you don't just snap your fingers and say, okay, this is now going to be legal. It turns out that there are 7,500 things that Medicare pays doctors to do. I see Nan nodding her head. She's had to deal with all this. So we have thousands of things that Medicare pays doctors to do, and there's a price next to each one of them. And what had to happen was Medicare had to go through the whole list and decide which ones were appropriate for virtual consultations and telehealth and which ones were not. And then they had to decide, well, is an audio visit going to pay the same as a visual? Is it going to pay the same as an office visit? So all these many decisions had to be made. If Hillary Clinton were president and the virus came along as it did, eventually we probably would have gotten telemedicine, but it wouldn't have been way back in February. It would be more like December or maybe even into the next year, because the Clinton administration would not have been focused on how to do this. We got this so quickly because all the groundwork had been laid by people working for Donald Trump who thought it was important. My disappointment with the president is that he's not talking about this. In August, he started rattling off some statistics on how many phone calls there were, and that was good. But he hasn't made a big point. He's too interested in telling people he stopped planes coming from China. Well, what was far more important than that was allowing people to talk to their doctor and have visual visits, virtual visits. That was so important, and it would not have been done, certainly not as quickly as was done, if he were not president. So that was a little long-winded, and thank you for putting up with me there. But
no, thank you. I intend to ask you another question that I hope you will enlighten us with every moment you speak, and I appreciate it very much. What do you think? This is the Goodman Institute for Public Policy Research is doing incredible things. You reach into the highest echelon of policymaking, namely, of course, the White House, but you also work with senators and congressional leaders as well. What do you think is the key thing that folks who want to support your incredibly important work, for all the reasons that you just mentioned? These are policy focuses that need to be at the top of the agenda for not only for voters who understand through listening to folks like you what they need to ask for, but also for congressional leaders. So, what is the Goodman Institute doing at the congressional level, at the Senate level? And how can those of us who want to see more of this, do the most good with someone like you?
Well, you packaged a lot of questions into
I did,
that,
yeah.
that one right there.
I know you
So,
can handle all of them.
all right. Well, let me just start with members of Congress. And what I'm going to say is true for both Republicans and Democrats. If you're a member of Congress, and Nan's been there, she knows what this is like. Healthcare is a $3.5 trillion industry. And so if you're a member of Congress, again, whether you're Republican or you're Democrat, you're going to hear from this industry. And you're going to hear from the hospitals and the insurance companies and the drug companies and the device manufacturers, and it just goes on and on and on. As Newt said earlier, the list is almost endless of people who want part of the $3.5 trillion. And so they're going to be coming to your office. Now, and also they will max out to your campaign. So they'll be in a pack and they'll give you the max. So you'll have to have the appointment with them. Now, what do they say when they come to your office? Does anybody come in and say, it's terrible that the patient can't talk to the doctor with his cell phone the way he talks to his lawyer and his accountant and all other professionals? No, they don't say that because I hate to put it this way, they really don't care about patients. They care about more income for themselves. And they never say, it's really unfair that employees have to take the insurance offered by the employer. Why can't they have insurance that they select and they can take with them when they leave the employer? Because again, sorry to say, their focus is not on the employee. It's on how do they get more income for themselves. So the member of Congress never hears about portable insurance, never hears about telemedicine, never hears about anything that would make life better for the average person. Now, when the congressperson goes back to his district or her district and talks to voters, well, they do, of course, care about themselves, but they don't think about the fact that, why can't I talk to my doctor on my cell phone? Talk to my lawyer that way, talk to my accountant that way. I get billed for minutes when I do that. Why doesn't the doctor do that? So the average voter doesn't think about that. And also the average voter doesn't think about why can't I take my insurance with me away from my employer? This requires a certain amount of creative thinking, and it's just what most people don't do. They just kind of accept the world the way it is. And then in the think tank world, this is all kind of goes together. The Washington think tanks tend to focus on whatever Congress is talking about. Congress tends to talk about whatever the special interests encourage them to talk about. So nobody is talking about the things that we're now talking about right now. We had been talking about the Goodman Institute for over a decade, but we're outside the Beltway. We're talking about it because our strategy from day one has been, we don't care whether Congress is interested in this or not. If I were primarily focused on what Congress was willing to do, you never would have had a health savings account. Because when I first went to Washington and presented this idea to members of Congress, there were only 6 of them in the House that were willing to sponsor a bill to do it. And so Washington think tanks don't spend a lot of time and effort doing something that only 6 members of the House are willing to go along with. But our theory was, look, let's find the good ideas. Let's not worry about what Congress is willing to do, and let's promote them. And with the passage of time, it really only took 10 years. We started out with every major interest in healthcare being against the health savings accounts, including the insurance companies, including the AMA. Within 10 years, they all flipped. That's how fast change can occur, but you've got to have a starting point, and that's what we did. And that's what the Trump administration has been doing. It's been looking at how to deregulate really healthcare, and it's making a huge difference. The rest of the world doesn't know it yet. Members of Congress are catching on. There is bipartisan support for allowing you to talk on the telephone permanently, even after the virus goes away. But that'll give you some idea. Now, I asked Newt why there weren't any hearings on what's going wrong with Obamacare. By the way, if it had been the other way around, if Obamacare had been a Republican plan, even if it were a little better than Obamacare, it would have had problems. And what do you think Democrats would have done if they controlled the committees? They would have had a hearing every week. Am I right, Nan?
Absolutely. Yes, that's what they do. Yes, yes.
And they would have paraded in people in wheelchairs.
Yes.
And you would have heard the stories about how they weren't getting the care they were promised. And there would be no end to this. Republicans, by nature, don't do these things, but also they pay too much attention to the special interests. And I really think that the insurance companies talk to these guys and say, look, you have a hearing like that, we're going to get the blame. Okay, so we don't want those hearings. So Republicans pay too much attention to the wrong kinds of people. And they do it because there's so much money involved and there's so much pressure on them.
But ironically, having been in Congress, and I can certainly attest to the fact that, and I've worked with the pharma industry and its periphery in my career, I can certainly attest to the fact that big healthcare, big hospital interests, big pharma, and increasingly, of course, physician groups of various sorts are very heavily invested in the regulatory structure and in regulatory capture and rent seeking. And I think that's a big part of the reason why they actually tend to identify very closely these days. In the past couple of decades, it's become ever more so, I think, with the Democrats. Don't you think that's part of it, John?
Well, what I think is that and this would be true of any industry, not just healthcare.
Yeah.
People learn how to live with regulations. They learn to work their way around regulations, and they invest a lot of time in doing that.
And they learn to profit from them.
Of course they do.
Yeah.
So right now, the Obamacare exchange, no matter how bad you think the Obamacare is for the patient, the insurance companies are making a lot of money, and they've learned how to live with it. And when industries are making money and they're living within an environment that they've learned how to live with, they don't want change. So it's not so much that they're pro-Democrat or anti-Republican or anything like that. It's just they've learned how to make money. And when somebody like Newt Gingrich comes along and says, hey, why don't we change all of this, or John Goodman or Nan Hayworth, they have no idea what's going to happen if we just deregulate the whole system.
Right.
They might make less money.
Yeah.
Even worse, that competitors would enter the market with new ideas,
Exactly.
and their competitors would be talking about phones and email and Skype, and they're not quite ready for that. So that's what's happening. That's what's happening.
It's interesting, John, apropos of what you just mentioned, of course, about their concerns over what their profit margins might be. When someone like Newt Gingrich says, look, healthcare could cost 40% less, and I happen to agree with him on that, it could cost considerably less. They probably hear something like that and a chill goes through them. Right. So, so I think part of but I see it as perhaps the way we can present this is that, look, we're going to need a lot of resources in healthcare, but we can use them more effectively, because as populations live longer, the fundamental lesion I don't think the federal government should run pensions and benefits at all, but the fundamental lesion in these programs is that the age of eligibility is set far too low for them to be sustainable. If I'm not incorrect in that, right? If you can retire at 65, or you're going to live to 95, your Social Security resources, your fund's going to run out, your account, and Medicare, of course, it's a 3 times differential. Most people on average get 3 times as much spent on them in Medicare as they ever put into the system. So what you're proposing, obviously, John, is a way to manage within those resource constraints.
That's right. And we didn't, Newt Gingrich mentioned price transparency, and we haven't said much about that here. So let me not overlook that.
Yeah.
it is really bad when you go into the medical marketplace and you have to buy before you know the price that you're going to pay. Here's what most people don't understand, that in the medical market, if you find a market where people are paying with their own money, so it's not a third-party payer. In other words, you're paying 100% of the bill, no employer, no insurance company, no Medicare, no Blue Cross. Those markets work really well, and you always know what you're going to pay. So
Right.
that would be what? Cosmetic surgery, it would be LASIK surgery. And it may surprise some of our viewers to know that there are a lot of Canadians who get tired of waiting for their knee replacement or their hip replacement in Canada, and they come to the United States and they pay a lump sum to a hospital to get this done. But what are they paying? They typically pay about the same rate as Medicare pays, which is about half of what private insurance pays for these same procedures. And they never have to guess what they're going to pay. They get a package price in advance, and they also pay in advance. But here's the surprising thing. What the Canadians are doing is exactly what you and I can do. They don't have some special way to do this. They have agents, and you and I can go through those same agents, but we don't. We're trapped in the Blue Cross plan. We're an employer plan, and those plans are tied to local hospitals. And the same local hospital that gives the Canadian a package price and a 50% discount won't give it to you and me because they think you're not going to travel. We'll get your business anyway. And so we need patients to be more aggressive, and we need employers to be more aggressive. And we could cut healthcare probably by more than 40%. So I agree with Newt, and maybe he's being a little conservative. There's a huge amount of waste there that's unnecessary and wouldn't be tolerated in any other industry.
No, you're absolutely right. And it has entirely to do with government's presence in this industry since decades now. And I have a question from George Pond, Dr. Goodman. Tell us about your new monthly healthcare letter, which I have seen and which is superb, going to decision makers and policymakers across the country.
Yes, I thought I had it here. I guess I don't. This is healthcare news. We're now partnering with the Heartland Institute to put this out. We started in June. It is the best news paper out there. It comes out monthly, and it gives a pro-free enterprise view of healthcare. And it's the only place where you can go to read on a regular basis about Trump administration's changes that are deregulating the healthcare system and freeing patients and freeing doctors and freeing other providers. So that's a huge thing for us, and it's been very important this election. Here is the latest copy, and you can get it too, by the way. And this goes out for free to 8,000 legislators. It goes out to virtually every legislator in the country.
Are you getting feedback about it, John? From
yes. And as part of our co-ownership of this publication, we've changed it. It used to be focused on state issues, and I pointed out that the Democrats have nationalized health care.
Yes.
And if you don't understand that, you're not going to be in the debate. And so our newspaper, you can see there's Donald Trump's photograph in the front of it. We approach healthcare from a national perspective because whatever the states can do often is only what the federal government allows them to do. And so that is a huge thing for us. We're also interested in starting up a social media campaign, which we'd like to have between now and the election. There's some urgency in getting the things out there to voters that we're talking about right now. And then beyond the election, these issues don't go away because, as I said earlier, almost everything we're now doing is under temporary authority, and it's not permanent. And it needs to be.
Yeah, and in fact, John, apropos of that point, I think, if I'm not mistaken, we have a question from Lee Curry, and I don't know if Lee can join us by voice now. Lee, are you there?
I don't think he can.
Oh, well, because this was sent to me, but Lee wants to know, what's the most important thing Congress can do to make the Trump health reforms successful? And I would say make them last.
Yes. It needs to make everything permanent. Your ability to talk to the doctor by phone, email, and Skype. The ability of your employer to put money into an account so you can have a direct primary care doctor that you can talk to at nights and on weekends. The price transparency, new regulations, the ability to have a flexible health savings account that meets the needs of chronic patients, the ability of insurance companies to specialize in cancer care, diabetic care, and get really good at something instead of trying to be all things to all people. These things need to be permanent, but also in many cases they can be improved upon. And I said earlier that Trump has made it possible now for employers to put money into an account. This is as of January 1st. Employers can put money into an account so employees can buy their own insurance that they own and can take with them, but it has to be Obamacare compliant insurance. Well, that's a terrible restriction because in most cities, most places, Obamacare is a disaster. The premiums are double what they used to be. The deductible is 3 times what it is in a typical employer plan. The network is really narrow and it excludes the best doctors and the best hospitals. Here in Dallas, where I live, you cannot buy individual insurance that will get you into UT Southwestern, which has been rated as the best medical research facility in the whole world. There's nowhere in Texas where an Obamacare plan will get you into MD Anderson down in Houston if you have cancer. Well, this is terrible. So we need the ability of employees to buy insurance which meets their needs and is not constrained by regulations which give perverse incentives to everybody in the market. Perverse incentives means people don't care about the sick. They're trying to attract the healthy and avoid the sick. And a market that in every other market, you make money by meeting people's needs. You find people with problems and you solve their problems. That's how you make money in a normal capitalist system. In healthcare, the other way around. In healthcare, these plans want healthy people and they want to avoid the sick. And if a sick person complains, they're not getting the treatment they were promised and they leave, the plan is only too happy to see them go because they're losing money on sick people.
It's it, and that is a terrible thing for our country, and it is one of the drivers, I think, probably, John, the fear drivers that Democrats play on. So here's my question for you. I hope we have time for one more, and I urge our audience to. I have another question, which is wonderful, from Virginia Moore. John, you mentioned that another executive order from a new administration could negate all benefits from the executive order on telehealth. How can the Goodman Institute prevent it from happening? It segues into the question I had, John. If there's a Democratic administration, what's Goodman going to be doing?
Well, you know, although we're often associated with Republicans, I've had no difficulty working with Democrats. Sometime back, Ron Wyden came to me, sought me out, said, I want your help on a health care bill I'm putting together with Bill Bennett. It was a bipartisan bill, and I did help them. And then Ben Cardin and Rob Portman put together pension reforms, which now allow companies to automatically enroll their employees in 401k plans and automatically put them into diversified portfolios. That was bipartisan. I was involved. Pete DuPont, our chairman, was involved. Peter Orszag was then at the Brookings Institution. He later became Obama's chief economist. I like to get things done, and there are not too many things you can get done in Congress if you ignore the other party. And I think everything we've ever advocated in healthcare, I think Democrats should be in favor of just as well as Republicans. It's really not, in my mind, it's never been partisan. It's just good public policy.
Exactly. Good policy is good policy. And more specifically to Virginia Moore's question about telehealth, which has been such a crucial advance, especially in COVID-19, which was a catalyst in that sense. How are we going to keep telehealth going if there's a new administration?
Well, we need to explain what's not being explained in the mainstream media or even in the healthcare media, and that is that this is possible only because of the Trump administration's executive orders and a temporary law change by Congress. And this is not at all permanent. And so we need to make voters aware of this. I've been amazed that on the Democratic side, although healthcare is a most important issue for Democrats as well as Republicans. They never talk about talking to your doctor by phone. You know, Bernie Sanders says we want Medicare for all. Well, Medicare was the last of the insurers to turn attention to the phone, to email, and Skype. Medicare is the last for almost any innovation you can think of. And they're not talking about reforms that benefit patients. They're talking about reforms that socialist ideologues think about.
Right.
So I think the candidate that talks about patients and how we're going to benefit patients and how they're going to relate to their doctor, both parties are ignoring it. The candidates that talk about those things, I think, will win on healthcare.
Yes, I could not agree more, John. And it sounds as though we're good on Virginia's question. So thank you for that. John, one last thing, because I know the one phrase that I hear repeated over and over again by both Republicans and Democrats, of course, is pre-existing conditions. What is the one key message that the Republicans, or, well, the Democrats, but let's say, you know, Trump is the enterprise candidate. We like to see what he's doing and the changes he's making. What can they do to
well, we need to start by saying this was a promise that wasn't kept. Okay, before there was Obamacare, if you got too sick to work and you left your employer and you go into the individual market, you could buy insurance at any time of the year. And if you were excluded from a private plan, most states had a risk pool. You had to pay a little bit more, but you could have that kind of insurance, and it would be a standard Blue Cross plan that would get you to any hospital, to any doctor. What's happened under Obamacare is you can't do that. You only have 6 weeks, and you have to wait until that 6-week period, and then you can only buy insurance that starts in January. So in many ways, you're worse off. And the plans that are available, as I said earlier, exclude the best hospitals, they exclude the best doctors. And so if you have a difficult cancer problem, you're closed off. You can't get to the specialist you'd like to get to. So I believe that people with serious health problems are being mistreated under Obamacare. I believe they're treated worse than it was before in many cases. And what President Trump should be doing, he says he wants an executive order on pre-existing conditions. I have been working with people in the White House, in the administration, suggesting things I'm suggesting to you all right now. And I'd like to see them make an issue of it, because President Trump says he wants to protect people with pre-existing conditions. The way to do that is to improve on Obamacare, acknowledge the faults of Obamacare in this area, and say how he would improve upon them.
John, I want to thank you for the wisdom you've imparted and for your incredible work, which is why I've been so proud to support the Institute for the years that I have. You are an amazing figure, and you have influence at the very top of policy in ways that very few individuals or institutes do. So in the last couple of minutes we have, John, can you just wrap up for us what you want everybody to take home about the Institute's work and how we can all move forward together?
Well, we have quite an agenda set in front of us. There's some urgency between now and the election. And even beyond the election, there's a lot that needs to be done. And if you'd like to learn more, let us know, and we'll do a one-on-one with you and let you know what our plans are and what kind of help we need. And if you know of others who should have been on this interview and would benefit from it, let us know, and we'll be happy to contact them. And once again, thank you all for joining us.
My thanks to you and to all of our audience, and I'm looking forward to their receiving the latest book by our special guest, Newt Gingrich, which is always exciting. So wonderful times ahead, thanks to the amazing work that you do, Dr. John Goodman. And we know you're going to have continued strength. Thank you.
Thank you. Thank you.